guys, this is the Purell Surgical Waterless Hand Scrub Solution. We are going to teach you how to scrub for surgery today. The first thing you do is pump 2 pumps. It will automatically dispense 2 pumps into one hand or the other. You take the opposite hand, rub the solution around the fingertips, between the web of the fingers, don't miss any skin surfaces, and up the forearm. Then we repeat the steps on the opposite hand. Fingertips, between the webs of the fingers, around the hand, and then again up the forearm. A third pump is optional for the hands only, if desired. After scrub, you will hold your hands as is in the chicken wing position. Do not put them down towards your body because you are likely to contaminate your forearms and you will have to repeat the steps again. The solution does not dry with a towel, it dries with air, and it takes about 1 minute to dry. You will keep your hands as is until you enter the operating room and your scrub tech puts your gown on you. Alright, this is how you put on a gown, gowning and gloving yourself without contaminating the table or contaminating your gown and gloves. I'll stick my left hand into the arm part of the gown and then my right hand into the arm part of the gown. And I will slip the gown over my shoulders, keeping my hands tucked right before the white cuffs at all times. I then open my gloves a little closer. If you miss a finger, it's okay. It can always be fixed. And now we will have the circulator tie our gown up, keeping my hands in the chicken wing position out at my sides at all times so that the nurse does not happen to contaminate me. The back of the gown is not considered sterile. Therefore, we have to spin our gown once we are tied. I take the string in my left hand, card in my right hand, hand the white part of the card to my nurse, spin the gown, grab the string, the nurse keeps the card. Then you tie your gown. Don't tie it too tight because it also has to come off at the end of the procedure. Once you're gowned, do not drop your hands below waist level, do not touch your shoulders. We say from chest to navel is the sterile part of your body, or set them gently on the patient. Do not lean on the patient. Now I'm going to gown the surgeon. I will drop the gown and tuck my hands behind the shoulders so that I do not touch my surgeon's shoulders. Once the gown is on, I will take and raise up the right hand so that I can put her right glove on. Once this glove is on, she can adjust her left hand as needed. She will take her right hand and help me open the glove to slip in the opposite hand. Once it's on, she can adjust as needed and then again turn the gown. She's not tied up, but if she were to tie with the scrub tech, since we are both sterile, she can grab the card, so you'll grab string in left hand, card in your right. I can touch all parts of the card since we are both sterile. She will then spin. Voila. At this point, I'm going to teach you how to properly open glove sterilely. This technique is used for putting Foley's on a patient sterilely, central lines in a patient sterilely, all kinds of different procedures where you have to glove yourself. I'm going to touch the outer side of the glove package And once it is laid flat, do not let it flip back over to the glove because then the glove is contaminated. I grab the cuff of the right glove, not touching the finger part of the glove at all, and slip it onto the right hand. I take my right hand and slip it under the cuff of the left hand, making sure my left hand does not touch any part of the right glove or the glove going on my hand except for the inner layer. And that is how you properly don gloves sterilely.